World Health Organization said today that widespread vaccination for COVID-19 is not likely until the middle of next year. So here to talk that through with us is Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Good to see you.
Great to be here.
All right, so at the same time as we hear that, we're seeing headlines here in the U.S. that we could have an approved vaccine by the end of October. Are you seeing signs that we may be closer to a solution than the rest of the world?
Well, I wouldn't say we're closer to a solution than other countries that are also conducting phase 3 trials. I will say that thus far, our Operation Warp Speed has really done what it was intended to do, which is to cut out those time-consuming steps that would otherwise protect pharmaceutical companies from financial risk, but don't affect risk to patients, and that's good. So what we want to see next is FDA approval as soon as safety and efficacy are demonstrated, but no sooner. And of course, then we need to get it deployed.
Yeah, absolutely. All right, so let's talk about this. There's a reliable model out now saying the U.S. could suffer more than 200,000 new deaths from COVID between now and January 1st, which is just staggering, but that we could cut that number in half if we wore masks. How significant is that?
This is very important. We now have the data that show that mask wearing in public really does prevent episodes of transmission and slow the spread of the virus significantly. And this model really shows that. And while a mask may not prevent every single transmission event that is prevented by a mask equates to a much larger number of eventual infections prevented and the corresponding hospitalizations and deaths. So as much as we all hate wearing masks, and we do, we absolutely have to continue in order to protect each other. Right,
until there's a vaccine, just wear the mask. Okay, so there's new interest today in the role that vitamin D could play in possibly preventing, maybe even treating COVID. What's going on with this? Do you see anything in the research so far that makes you think it's promising?
Yeah, well, so far the research in this area is what we call retrospective, which means that it looks back at individuals who had vitamin D levels measured in their blood and found that those with low levels seem to have higher rates of later acquiring COVID-19. So to really know whether vitamin D supplementation could help prevent COVID-19, we need prospective clinical trials, and those are being planned. I would just like to caution against anyone taking higher than recommended doses of vitamin D supplementation, though, because that can be associated with serious side effects.
Okay, so maybe just stay tuned on that one for now. All right, Dr. Doron, thank you for your time. We appreciate it. Have a good weekend, and we'll see you next week.
Thank you.